Hungarian cookie.
While Dr. Max is talking about Hungarian cookies and showing you how he can chew, I'm going to introduce our podcast and video series related to all things that we feel are important to you and your well-being and your health, which is basically everything. It could be talk about chiropractic because we're both chiropractors, but it could also be food or coffee or movies or books or anything that we feel is going to positively impact the way that you view your life and your health. So with that, my name is Dr. Lou Jacobs. I'm a chiropractor, acupuncturist in Portland, Maine, certified in perinatal and pediatric chiropractic, and have been a chiropractor since 2002. And sometimes I practice in Romania too.
And I'm Dr. Max Jacobs, and I practice in Portugal, and I've been a chiropractor since 2006.
We have a pretty international perspective and worldly perspective with what we do that I think is exceptionally valuable. There are lots of chiropractors who travel and do great work all over the place, and it lends itself to an experience with patients with different expectations and issues and desires and philosophies on health that give us a perspective that we think for the average American or viewer or listener to this, I think it'll be really beneficial. So with that said, the topics for this week have been put together by Dr. Max, and we are going to discuss them starting right now.
Okay, well, what I wanted to talk about was different motivations for people to start chiropractic care. Because I think there are several potential reasons and ultimately several different motivations. Where I practice in Portugal, the thing is most people who come to see me have never seen a chiropractor before, and many of them are largely unfamiliar with what chiropractic is, what chiropractors do, and therefore whether or not it's the right place for them to be. So when I think of our motivations for starting care, I think of this in terms of kind of a hierarchy, a little bit sort of low to high in reasons.
Can I interrupt
so I
for a
could
second?
Call them. Okay.
Did you brush your hair this morning?
No.
Okay.
But sometimes, you know how you get out of the shower and you wouldn't. For our viewers at home, he wouldn't know what I'm about to refer to. I was going to say when you're drying your hair.
Yeah. All right, get back to the discussion.
Anyway, there will be at least one bald joke per podcast. That's a promise. So I was talking about sort of lesser reasons or motivations to start chiropractic care, and then higher motivations, for which there could be many. But to start with a lesser motivation, I think the most basic one that we see is people who have pain and they wish to be out of pain. That's a very basic motivation.
And that's typical because of stereotypes of what chiropractic is about that have been sort of spread throughout the world. I mean, if we look historically at the beginnings of chiropractic in the late 1800s, early 1900s, people were not seeking chiropractors for help with pain in their back. They were seeking help with all types of health issues and trying to reestablish better health in all systems of the body. It had nothing to do with back pain whatsoever.
Right.
Or pain of any kind.
Exactly. And so most famous example of that is the first so-called chiropractic patient, Harvey Lillard, did not have back pain. He was deaf. And the story goes that actually it took D.D. Palmer some time to convince him to try the first adjustment that was ever done, probably because he was deaf, so it was difficult to communicate with him. But it had nothing to do with pain.
It's not funny.
So whether it's fortunate or not, I don't know that most people come to us looking to get out of pain. That's a fine place to start. I think that's acceptable. But that's just one motivation of many.
Right. It's like they
And
say, if you're using chiropractic only for back pain, you're missing out on 98, 99% of what it's good for. I mean, it is.
exactly.
I agree with you. I think it is acceptable, but it's unfortunate that that is how people end up in the office, because ultimately, if they ended up in the office for reasons of overall health and well-being prior to getting into pain, they would be far, far, far better off, and would probably never need any sort of pain relief,
Right.
barring some kind of major accident.
Right. So, so I think also, we have an expression in English-speaking countries of "don't shoot the messenger," and I think of pain as a messenger. It's just a signal, and it's telling you that something's wrong. So if you have pain, you know you have a problem, and probably if you think about it, your goal isn't just to get out of pain. You probably also want to fix the actual problem that's causing the pain in the first place. So we get to another level of motivation, which is not just to be out of pain, but also to really correct the problem and keep it corrected over a long period of time, because we know problems have a tendency to recur. So a certain level of maintenance is generally required.
It's
And
almost
this would be a
guaranteed.
higher level of higher motivation.
It's almost guaranteed that they'll recur. It's sort of like, if you don't brush your teeth for a week, your teeth are going to feel fuzzy and disgusting. Guaranteed, because
Right.
the stress,
But there's an exception.
because the stress
Your
of
teeth,
food.
your teeth wouldn't feel totally disgusting if you stop eating completely. If you if you just give up food entirely, probably your teeth would stay reasonably clean.
They would stay reasonably clean,
Okay.
but they would still feel fuzzy and gross, just from the slime that builds up when you're sleeping in a dry bedroom.
Right. A little bit. A little bit. So we have all of these causes and conditions that lead to having a problem, and we're not necessarily getting rid of those causes
But
and
what percentage of
conditions.
people do you feel come into your clinic and say, "Hey, I," you say, "So why are you here? What can I help you with? What are your expectations?" And they say, "Oh, well, I want to fix the underlying root of all of my problems." How often does that happen? The
That's pretty rare.
the mindset is pretty backwards, because we're not taught to do that. We're not
Right.
taught to do that. We're taught that when we feel something, that's when we have a problem. We're not often told what the underlying issue is, and certainly a lot of times that underlying issue is not cared for. What's cared for is the symptom. So you're putting a Band-Aid on the hole where your leg used to be after it was ripped off by a shark. And
Right.
you're not addressing any of the underlying issues. I mean,
So
nobody comes in.
that's why I would call seeking only pain relief as a lesser motivation for receiving chiropractic care.
But a justified one under the circumstances for people who don't know better.
Absolutely.
Yeah, of course.
Definitely. And I think for most people, many people may start that way, but then ultimately come to understand the underlying problems that led to the pain and genuinely wanting those to be better. Obviously, for most people, I think that's true. Um, but then there would be definitely another higher level of motivation besides just pain relief and correcting the problem and keeping it corrected. Another level would be looking to enhance one's health and level of adaptability under stress, under all types of stress, to live a better life, to live a more comfortable life, because the world is not becoming less stressful.
No,
I'm
but you're going to
noticing.
have to explain, or one of us is going to have to explain, because people, if
Mhm.
the majority of the people think of chiropractic as back pain, they're not going to have any idea why they would come in for that. I mean, because they're still, even
Yeah.
even after just hearing what we've just said, their mindset is still, well, what about my back? What about my back? What about my back? Right? So
Well, this is related.
How does taking
this is
care of
definitely
your back
related because anybody with a back
managing
issue,
stress and adapting?
right? Yeah, it's not adapting, and there's obviously reasons for that. And adaptation and handling stress of all kinds in a human being, that is done and processed through our nervous system. So it becomes the goal of chiropractic to um, reduce and eliminate any interference to that system, and then ultimately have it optimized. Have it working at 100% or more.
Right, and if people understand anatomy at all, that you'll understand that all of these nerves that control the entire body come out of the holes in the sides of the spine, and misalignment of the spine and tension in the ligaments and tendons and muscles and inflammation can all lead to pressurization of these nerves. And if you've ever hit your funny bone, you know that pressure on a nerve is not a good thing. The only problem, though, is that you can't really, I mean, for anybody who's listening, for the person that's listening, only 10% of nerve fibers feel pain. The majority of the stuff that our nervous system communicates is stuff that you don't feel. So if you're waiting to feel something to drive you to seek optimization of your body's functions and optimization of adaptability, and not necessarily even optimization, just normal, maybe. Because you don't, gauging normal when you can't feel everything is a really difficult thing to do. But 10% of nerve fibers feel pain, the rest don't. It's sort of like getting your blood pressure checked, getting your nervous system checked. You need to do it whether you feel your blood pressure squirting out of your ears or not, right? I mean, how do you deal with that?
Right.
I mean, we're oftentimes too busy to go out and talk to people about this, but you can't wait. If you wait for a problem to occur, you've waited too long. That's what most people do. Everybody that comes in, with the exception of like 2 people out of every 100, right? Everybody's coming in to do damage control first, and then you've got to work backwards. Anyhow.
Yeah. Prevention is not necessarily a part of our Western culture.
It's certainly not here.
In many ways.
In the States.
And not in Europe either.
It's a disaster.
We're more alike than we are different.
We're as people say, we're born to be healthy.
Right.
We're born equipped with everything that we need to produce all the chemicals we need, to produce all of the enzymes to digest food, to do all of these perform trillions of functions all the time. We're designed to do that perfectly without the need of anything else, unless bad things happen to us or we don't take care of the system that we've got. And that's when the S hits the F, and then you have problems.
Yeah. Right. So that brings us back to coming to seek chiropractic care with a really high motivation. Which if you can and if it makes sense to you, it's wonderful to see a chiropractor with a motivation of whether you have pain or a problem or not, going there because you know how vital the health of your spine and nervous system is for your entire experience, for everything in life that you do and that you want to enjoy. That's all entirely reliant upon the health of your spine and nervous system. You can't be functioning at your best and enjoying life at the most when you've got pinched nerves throughout your spine, when you've got poor nervous system function. So I think the
nervous system is the processor and the system in which things happen to make things happen. It's like, if your computer's running slow, you're going to reboot it if you have any brains, and it's going to run faster when you turn it back on. And that's exactly what happens in a chiropractic office. You get your nervous system rebooted, and things work faster, function better, and if you continually restart your computer every 2 to 3 days, or even at the end of every day, you're going to have a much faster, smoothly running computer forever.
Yeah.
Hallelujah.
So that brings me to the next thing, which is, well, first, actually, maybe you can answer this. Why should someone? Is there a situation where someone should not start chiropractic care, or they're due to their situation or their motivations for starting, it's better for them not to?
No.
Is there a situation like that?
No. No, there's no.
Even if someone is coming
situation.
in and they say, okay, I have 40 years worth of degeneration. I've never taken care of myself my whole life. I want you to fix me in one adjustment.
Well,
what would you say to that?
That's unrealistic.
Unrealistic, right?
That's unrealistic, but it's not a reason to not come in and get help. I mean, for as long as you're able to digest food, as long as you're able to cut your finger and have it heal, then there's a potential in your body to heal and function well. And there's no reason to sell yourself short, not have that, by not managing the system, the nervous system. I mean, so no, there's no reason not to. There's never a reason to not.
There are pitfalls where people could not get the most out of care because they don't, they're not totally familiar with how chiropractic works.
If you've beaten yourself up your entire life and you come in and there's a lot of structural and neurological work to do, you may need more care having waited than you would otherwise. I mean, early is always better. Look, I work with tons of kids, and I had a kid who came in. The mom brought the kid in a couple months ago. He had his neck was turned to the side. His head was shaped like a oblong squash. A plagiocephaly, which is like a weird lateral and front to back contortion of the head. And we got in there and started doing cranial work and neck work very early on, before things had fused, before the kids started walking. Mm-hmm. And head shape is perfect, and neck is seemingly perfect at this point. And it took a couple months because it was quite significant from birth. But if we had waited longer, it would have taken a lot more work, or if it would have rendered it would have made it much more difficult to make the change. So waiting too long is not a good idea. There is absolutely no reason why people should not, as a standard procedure, just like an annual checkup at your medical doctor's office, there's no reason why you shouldn't go to the chiropractor and have your spine and nervous system checked. There is no such thing as a spine transplant, and you can't take nerves out of one animal and put them in you to make your body work better once it's destroyed. You've got one system, and if you don't take care of it, you're going to pay the price at some point. So there's never a reason to say, oh no, I shouldn't go in there. There's never a reason to turn anyone away unless they are absolutely perfect, which usually doesn't happen because there's been some period of time where people haven't taken care of themselves and life keeps coming. It never stops.
Yeah, one thing I like to explain to people is that because we are making every attempt to measure the dysfunction, the levels of what we call subluxation in the spine, because we're measuring these things and we're checking periodically at how the correction is actually going, there can come a time where we evaluate them through the various techniques and imaging that we use. And we can honestly say, we don't need to adjust you today.
Yeah.
You're good.
Yeah.
You're good. Come
happens.
back, come back in 2 weeks, come back in a month, come back whenever.
It happens.
That does happen. It's happened to me here with people. It's awesome. And it's absolutely like the most gratifying thing, I think, for us. So yeah, that can happen. And it usually happens with people who are very, who stick to the care plans that we give them and are very disciplined and take it seriously. For those people, it really does happen. Which brings me to the next thing, which is why do we put people on a care plan, and how does a chiropractor decide what is the appropriate care plan for you?
Before we talk about that, it's absolutely critical that if you do see a chiropractor, which you should, that you see one that does follow up with follow-up tests and not just leave it to guesswork. I mean,
Right.
there are so many times where people come into the office and we run our tests at the beginning, measuring nerve irritation and muscle irritation and all of the things that can contribute to misalignment of the spine that irritates the nerves. And I asked them, have you ever had those tests done before? And they say no. And they've been to chiropractors before. They not only have they never had it done once, but they've never had it done twice, 3 times, 4 times to follow up to make sure that progress is being made. I mean, you would never send your kid to a school, let's just say a private school, and not ask for how they're doing, not expect grades. Like,
Right.
I mean, there has to be
Right.
some sort of grading system for progress, or you're just throwing yourselves out to the wolves. Anyway,
Yeah.
what was the question?
Well, so it's why do we for people who are not familiar with this, why do we put someone on a care plan where we say
Right.
you need to come in this many times over more or less this period of time, and how does the chiropractor make that determination? Okay, because hopefully, presumably, it's not just because they're trying to fill their wallet. They have specific reasons for why they're saying you need to do this, you need to follow this plan, not this one, but like this. How do we make those determinations?
How does a medical doctor that puts you on a medication determine how long you're going to need to be on that medication for and in what dose? There are predictable signs based on what somebody's coming in with that determine how you make a decision. It's no different than determining really how long it's going to take to shovel the driveway when there's snow in it based on how many feet of snow and the quality of the snow. I mean, so
here
I know
in Portugal, there's no snow.
Right. How big of a basket for your olives are you going to need, given how many people you're having over? I mean, over time, you learn, right, as a professional, what someone's life means to the health of their body. And so when you sit down, we create these plans based on the facts, the objective facts that you see on the testing, and then based on the story of their life, which is basically a summary of the wear and tear on their body, the incidents and accidents that have led to where they are now. Who you are today is a sum of everything that you've done or not done, or has happened to you or not happened to you over the course of your entire life. So the plan comes from an insight into how one's body is going to respond based on their history to the chiropractic work that we do. And it is predictable, and it's not perfectly predictable, but a great chiropractor ought to be able to give you a pretty good idea of how long it's going to take and how much it's going to take. I can tell you this, when I go to Romania and I work, there have been situations over there that were very different than here in the States, where here in the States people are sort of driven erroneously by their insurance plan and what it covers, right? So I'll often only see somebody 3 times a week at the beginning of a care plan when they're in sort of crisis damage control, because again, they're coming in for reasons of pain. And so obviously they want to feel better. Chiropractic isn't a magic bullet for pain relief, but if you reorganize the body and get it working better, the pain goes away typically in a pretty decent period of time. So anyway, 3 times a week is pretty standard here for somebody who comes in, and that's based on they're not waiting until they need to go to the hospital. They're coming in before that. So usually 3 or 4 times a week gets people off to the races. In Romania, I see people 3-4 times a day sometimes. And it's because I have a limited amount of time. But what I found there is that when we do that, they get results much, much faster. So many times the treatment plan will be, all the time really, the treatment plan is based on what's needed and what somebody's expectations are. If you come to me with a big problem or you need a lot of help, or maybe even a problem you didn't even know about, right? And you need a lot of help, the plan is going to be more intensive, just like a heavy dose of antibiotics at the beginning of an infection, and then it tapers off. It's just, I mean, I don't know. I guess it sort of feels like common sense, but if you have a big hole in your roof, it's going to take more work than if you have a small hole in your roof.
Yeah.
I don't know. This is not rocket science. It's so, chiropractic is so much like structural and electrical engineering, even on a basic level, that it's almost absurd. I mean, if you have a crooked foundation on your house and mice are eating at the wiring of your house, it's no different than having a subluxation of your spine where nerves are being pinched. And what's it going to take to fix it? You can create a plan for that.
Yeah.
That's pretty reliable.
Yeah. And I think this is also where the experience in years and in hands-on experience with people makes a huge difference, because to predict how things are going to go for each individual person, that gets really easy as the time goes on, compared to, for us, I think when you first start out, your guesses are of course less accurate. They're educated, but they're less accurate than they are after 10 or 15 years of practice.
No, of course. I'll also mention that it's hard to predict. I mean, it's easy to predict the big picture if somebody follows the plan of action, right? The care plan for correction of subluxation. If they follow the plan, it's pretty safe to say that the prediction over the course of a longer period of time, like let's say 6 months, even a year in front of us, will be able to give you a good idea of where you're going to be. But the checking in and the monitoring needs to be done, especially at the beginning, a little bit more carefully. If I went to a chiropractor or any doctor and they said, do this for the next 6 months or a year, and we'll check in a year to see how things are going, because this is my prediction, there's a little bit too much of a crystal ball method there. And I think that, like what we do here that people really appreciate is, and you do the same thing, is that after 4 to 6 weeks, we'll do a re-exam and we'll check to make sure that what we've done in that short little burst at the beginning has really started to take effect. Or at least, and if it hasn't taken effect because the problems are too big, then we can still manage to see the direction that we're going in and where to go from there. But we're not waiting too long to find out that what we're doing is really working or not working as well as maybe something else could be.
Yeah.
I don't think it's good to not do those re-examinations very regularly. It's got to be done.
Yeah. I would just add to that, I think we're both using pretty much the same technique with maybe some slight variations. And in that technique, after adjustments are completed, we actually recheck. So for most people on most visits, we're using this and other techniques to find the areas of dysfunction. We're correcting them, and then we're double checking. We're checking our work. We're making sure that what we tried to do has been done. And if we find that it's not quite perfect, we probably have more work to do.
But even at the
end
of the visit,
and we do that on almost every visit.
Even on every visit, the correction can be made and things can be much better at the end of that visit. And then you go back into the world and the stress of your life disrupts things again. And that's normal, of course. That's typical.
Yeah.
But there are methods for checking things at the end of every visit. You're right. Yeah. And over time, if you correct things each visit well enough, over time, it just stays. Right. And you're corrected. Hallelujah.
Gradually. So, those are my questions. We can switch gears for a second. Because I sent you a link to a piece of literature that I wanted to mention.
Why don't you mention that?
I'm reading a book, and it's called A Monk's Guide to Cleaning Your House and Mind. And it's a small little book that has actual practical advice on cleaning, but from this perspective of making it at the very least a mindfulness activity where you're doing this with a discipline that is also assisting you psychologically. Is that confusing? I mean, does that make any sense?
Did you say something?
You have to pick up the book, and let's just put a little thing here, so
I'll find a picture of it. I'll find a picture of it, and we'll put it up there.
I would post a picture of my copy, but it has just has lots of scribbles on the front now, thanks to a enthusiastic 4-year-old.
Oh. Is that it?
Yeah, that's it. It's a good book. It's awesome. I'm not finished with it yet, but it's not going to help you grow any hair, but it will help you clean your house and enjoy it on a whole new level. People need this kind of thing. I think it's important. It's very important.
All right, we'll put a link or something.
Put a link in the show notes.
Yeah, I'll put a link in the show notes. Anything else going on over there?
No, I was going to mention we had an amazing case. Actually, we talked last week, and something came up about people coming in, unable to walk, and then they leave walking.
Yeah, right.
And it's funny because we said something about that, and then the first person that I saw when I got off the phone was someone who came in limping, and sure enough, after some adjustments, walked out basically normally, which was kind of funny. But for the past month, just once a week, I've been adjusting this teenage guy who for 2 years has been unable to smell. And that's what he came in for. Not for back pain, neck pain, or anything else, just because for 2 years, no sense of smell whatsoever. And he told me last week before the adjustment that the day before, he could actually smell his cologne for the first time ever. Oh. He didn't actually know what it smelled like. He's been using it for quite a while, but he didn't know. And it was just the very first time that he could actually smell it. And then we tried a few other things, and he could smell other stuff too.
Yeah, that's pretty cool.
It was pretty neat.
And a good example of non-back pain related stuff. I had a lady, she's been coming in for a while, but she came in for back pain, and her back basically feels the same, but there's a lot of issues there. It's it's a little bit better, whatever, but her headaches have gone away. Her menstrual cycle isn't as painful. All these other things. There's so much improvement in other areas that she didn't know were going to improve by through the restoration of better nerve function, that she had no idea. She wasn't expecting it at all. We did the re-exam last week or the week before, and she was like, and I kept poking at her like, has anything changed? Your back, it is what it is, but have you noticed anything else? Well, my headaches, and at the end of the visit, I was going through the list of the complaints that she had when she first came in, and so many of those things had improved, and then she just kept rattling off more and more stuff unrelated to her back, related to daily function and like the cycle thing, and she had no expectations of that whatsoever, and she was totally blown away. She left us a really nice review on Google because of that, and she hasn't even gotten what she came in for yet. It's coming, it's working, it's just slow because of her history, but everything else is improving first. which is amazing. It's so cool
Mm-hmm.
and such a important thing. People, I think, are they really are missing out on opportunity for living sort of their optimal lives, and healthcare is so screwed up. And anyway, whatever. We'll talk more about it next time.
Yeah. Okay, gotta go.
All right. Adios.
Adios. Ciao.
Bye.